we recently had the chance to meet with our colleague, Dr. Russell Barkley, a leading authority on ADHD, to discuss the keys to successful school-based support for the student with ADHD.
But if you think of ADHD as a problem with the ability to control your own behavior, self-regulation, it leads to the next question of what is self-regulation? What are the components of self-regulation? What are normal students doing that they're able to control themselves so well? What teachers ought to be amazed by is the fact that most children sit, follow rules, listen when spoken to, get their work done, get along and cooperate with other children. That's the miracle of the classroom, is how you can get so many individuals to cooperate so well. And I think that's a key as to what's going wrong with these children and how we might help them.
I think that with some of the recent publications that you've had in terms of the theory of ADHD as an inability to delay responding, talking with school personnel about that, I think that really strikes a chord with them. I think that really, it helps to explain some of the behaviors of the kids that they see in their classrooms. And I'm just wondering if you could talk for a minute about what some of the treatment implications, in particular for a classroom setting, that your theory would pose for
Yes.
educators.
Stage 4 of our model, intervention, planning, and implementation, makes use of what was learned in the first 3 stages of school-based assessment. We join the instructional support team as they address some of the key questions regarding intervention planning. These are, what are the behavioral objectives of the intervention plan, and what interventions can best achieve these goals?
In addition to Mrs. Lopez, other members of the team are Mrs. Baton, Mrs. Ryan, Wayne Trumbauer, the school principal, Jan Miller, the school counselor, and Jan Larson, the reading specialist. Not all schools will have structured teams like this one. We recommend, however, that a multidisciplinary approach be applied as diagnostic decisions and intervention plans are made.
So, Anita, when does it seem to be most pronounced, and when does he have the most difficulty in the classroom?
I would say that it's during independent seat work that he's unable to attend. He's at his neighbor's or somebody else's or looking around. When I'm standing there giving him directions and standing right over him and giving him, then he seems to do a better job. But whenever he's kind of on his own, doing it independently, that's when he seems to have the most difficulty. And I'm very concerned